Hello, everybody. This is Dr. Susie Harris, and this is my podcast, Next7. Next7 is your guide to building a healthier, more vibrant future for yourself and the next 7 generations to come. Through inspiring conversations with functional health and wellness experts, we explore the tools, the practices, and the knowledge needed to achieve whole body health. From nutrition and fitness to mental wellness, clean living, and holistic care, we aim to empower a community of passionate individuals dedicated to creating a thriving world for today's elders and tomorrow's generations. May you feel activated to get involved. Hello and welcome, everybody. Thank you for joining us today. I'm Dr. Susie Harris, and this is my podcast, Next7. And I have a really awesome guest with me here today, Christiane Herskowitz, who has a business called Body Connections. We're going to tell you more about that in just a few moments. But you know that in this podcast, one of the things we try to do is introduce you to people who are doing awesome work that you may never have heard of for lots of different health conditions. And we're going to get into that later too. But Christiane she's been around for quite a while, 30 years of experience. Is that right?
Yes, that's right.
All right, cool. And I'm just going to talk about you for a minute, okay?
Sure. Thank you for having me.
Of course. So what I understand is you graduated from the physical therapy program in 1991 in Munich, Germany.
Mhm.
And you've been practicing as a registered physical therapist in Vermont since 1996. And you're a trauma-informed therapist, which we're going to get into. And you've also been doing the Cranio Sacral Therapy since 8. These are all really awesome therapies that I really get excited to know people are pursuing because they can reach into some really awesome depths with their health. And I just want to thank you for being here with me today and for also doing this great work in our community.
Thank you for having me.
Yeah.
Here.
Let's start off with, first of all, where's your practice located?
My practice is in Williston, in the old village,
Okay.
easy accessible with parking.
Oh, that's great. And we'll have links for people so they can find you. I wanted to just hear a little bit about your work first. If you can take off with whatever you want to talk about. I'm hoping to hear what's the work you're doing and how could it benefit folks in our community?
Yeah, that's a good question. So I'm a Cranio Sacral Therapist by training, as you mentioned. That's the longest I've been really working with. And I added a lot of different tools over the years
Mm.
to dive deeper into. It was never enough. Okay, so now I know this. Now I can help this. This is still happening. What else is out there that I can integrate? And besides the craniosacral therapy, I did further training into therapeutic dialogue training with heart-centered therapy, somatic work training, um, trauma-informed training through a professional trauma um, program. And I include visceral manipulation. And yeah, those are pretty much the main tools I use, and also including brain curriculum, which is another way of tuning into the body. So craniosacral therapy is really a tool and a therapy, which is a very light touch, hands-on therapy where I connect to the nervous system and to the brain.
So
And
does that mean you're like placing your hands on people's head or what does that mean?
yeah, I usually start at the feet just to scan and get a little bit of an idea what the body's doing, tuning into the body. I attune to each person and their body and their energy and just meet them wherever they are. And then I will then evaluate the system further, the craniosacral system, which is a system that is embodying the nervous system, the central nervous system, and the brain and the cerebral fluid that is bathing our brain and our nervous system that's flowing around. So with that fluid system, that's what we're working with. And if as we're working with that, we're helping regulating the nervous system and any patterns that the nervous system at some point when any for me, trauma is any moment or any event where our nervous system felt overwhelmed. And then we creating certain patterns
Hmm.
and restrictions, be it
Okay.
physically, emotionally. And those patterns I can pick up, and those patterns may come forward. And there's like a self attuning and a self healing tool as the body feels the support to then from within re-pattern or release the patterns that were stuck or release emotional or physical patterns within to
Okay.
then allow the flow and then allow maybe it could be emotions coming up. That's where Cranio Sacral Therapy has also some more somato emotional release. So we
Let
learn
me
how to
let
work
me
with
ask
those
you let me
emotions.
ask you a quick question about that. So I'm
Yeah.
trying to follow. So I'm a patient and I come in, you're gonna have me lying comfortably on a like a massage table sort of thing.
Mhm.
And if I heard you correctly, the first thing you're doing is just touching base with the person's energy at their feet.
Mhm.
And you're assessing with the craniosacral if the person has easy flow of energy and cerebral spinal fluid through
Mhm.
their brain and spinal cord with the techniques that you use. So you're checking in and you might find, oh, this area isn't flowing like it should. And then
Mhm.
you've got techniques for addressing that and reopening and integrating that so the person can restore that flow.
Yeah, I think that was a good summary. So the craniosacral rhythm, I'm tuning into the craniosacral rhythm, which is the rhythm of the cerebral fluid. And that has a certain rhythm, a certain number. And if that's off on one side or somewhere, then I'm getting directed by the body that, okay, this is an area that we can work and open up. And sometimes, and I'm just following the body's cues,
Mhm.
listening to the body, responding where I need to be.
Okay. So if I have, let's say you're assessing me and you sense a block, how might that relate to my health?
That's a very good question. So when there are blocks and there's not flow,
Hmm.
that could be an emotional block. It could be a physical block. That all any block or any stuckness in our body changes things in terms of the quality of the function of our viscera, of our organs, of our heart. There could be so-called, we call it energy cysts in the craniosacral world, where emotions are I always show it on a shirt is I turn this and make a little knot in this shirt. There's a set point of a tension pattern. And
Yeah.
tension pattern is then pulling all the way into the matrix of our body. And
Wow.
if you then go to that center point to release that, you releasing other areas within the body.
Just got chills thinking about that.
That could be an emotional energy cyst. There could be toxins. There could be physical energy cysts through accidents. So all of that.
Hmm.
And we all learn at some point, as I mentioned before, trauma is any event in our life where
Hmm.
our nervous system felt overwhelmed and goes into a trauma response and
Okay.
a shutdown or into whatever trauma response it has to do.
Hmm.
And very often there's a disconnect at the same time from feeling and from our emotions because that would be even more an overwhelm and we can't feel that right now. We just have to make it through what we have to make through.
Yeah.
And those can also be then pushed down. They have to go somewhere, those emotions, right? If they're not getting released. And
And would that be
they're
that could
holding
cause an
energy. They're holding energy in our body and could cause restrictions.
okay, so having an easy flow between so the fluid that flows around the brain and spinal cord, if that's easy and flowing, it allows the body to be in a higher vitality, better health, and you're catching where either an emotional moment that someone couldn't process at the time, got stuffed somewhere, that could create a block in that flow, or a trauma like a car accident or
Mm.
and like that. So that's
And
been
and with that, even like a car accident, there are emotions involved, right?
all
Involved.
right. All of that.
So we can't separate them. They're always together. The physical and the emotional, it comes together. We always have some kind of an emotional reaction to a physical,
Mhm,
other way around too. Physical reaction to an emotion. As simple
mhm,
as we got butterflies in our stomach, right? And they are physical just through that emotion. We have physical reactions to that.
mhm. So it goes
Um,
both ways. Your
it goes both
mental can
ways.
cause physical, and physical can cause mental or emotional. I know I've referred some of my folks to you that have come to me either for chiropractic or the nutritional healing programs that we do, and they've done the work. They're doing great. They're doing all the right things, but we haven't really seemed to loosen their issue. And what I love about your work is there's something in the assessment and the work that you do to clear blockages that unlocks the case. They start to get results after they've had some work with your style of stuff.
And part of it's probably also I work with the nervous system dysregulation
Mm,
because at those points, whenever our nervous system does get overwhelmed, there's a dysregulation of the nervous system. If the nervous system is dysregulated, the absorption doesn't work properly in our body. We don't absorb properly the nutrients that we need for the
mhm,
vitality and for the function. And
mhm,
that's where your beautiful work is coming in to also help with those deficiencies and finding
mhm,
what the body needs. And that's where the regulation of the nervous system is so important. And part of somatic work and part of nervous system regulation is also Cranio Sacral Therapy. It helps regulating the nervous system when we are, for example, stuck in the
mhm,
sympathetic and in
mhm,
this um, activated nervous system state of restlessness and anxiety. And for whatever reason that we're stuck at that, but
mhm,
it's the cortisol is increased and everything is working in the exertion of where we really should be in this calm aliveness,
mhm,
work in balance, and takes a lot of energy from our body and has
mhm.
all the effects of being in the sympathetic. Or then the other state, so speaking of the nervous system, so we do have the parasympathetic state, the calm aliveness,
So that's
where
when people are calm and regulating well.
with a social engagement, where it's easy to socially engage and curiosity and healthy and present, grounded, connected. That's our calm aliveness, parasympathetic state. Our nervous system goes in this beautiful flow even through the day to get us into the sympathetic when we need energy for a sports event or for a presentation or
Mhm,
for whatever we need. But then also if there is a startle or if there is something that our nervous system really has to go into fight and flight,
mhm,
all these stages. And then eventually, when it's not sustainable anymore, or that is not taking us anymore, the nervous system beautifully takes us then, where it needs to take us into the overwhelm and freeze. And that's the state where we can get stuck in, or it also can again, it can be a functional freeze. We can go in and out into the sympathetic and then in freeze
mhm.
again, where we don't have the energy and be exhausted and
Mhm.
feeling stuck and depressed,
Yeah.
things like that.
So
So
when you're talking about nervous system dysregulation or the nervous system isn't regulating as properly as it could be, could that, I'm assuming that could have effects on sleep, blood pressure, blood sugar for people who are doing all the right things and they aren't seeing cardio health and all these things. If their nervous system is stuck in one of these patterns and not regulating correctly, it can be a root cause issue that your work can pick up on and maybe get some traction in those areas.
absolutely, because then that's where when my clients learn how to regulate the nervous system, and that's where somatic work is coming in, which I'll talk briefly about in a moment. With self-help tools,
Mm,
I usually always start now with somatic work to so patients can understand those different states of the nervous system and find themselves, oh, where am I? Huh, how interesting. This is where I am. And
Mm,
then also tracking it more and getting more in tune with their senses and with what's happening in their body in certain times, and
mhm,
getting some tools to
mhm,
regulate more
mhm.
with somatic work. And then we're doing the Cranio Sacral Therapy and just looking more into deeper way. What else is there? Is there anything that needs to come up or anything wherever they are? What
Mhm.
is we just listening to the body, there's nothing needs to happen. It's just what is,
I see.
what
So,
can happen in the moment.
could you give me an example of in the somatic work when you're teaching a tool to assess where you are? What are the different categories of where I am? How, if I'm checking where I am, what am I checking?
So I usually explain
Mhm,
first the three states, first of
mhm.
all, that we
Yeah.
understand, okay, there's this calm aliveness, there's this sympathetic, fight and flight, anxious, hypervigilance, can
Mhm,
sleep, restless,
mhm.
or there's a freeze and overwhelm, the dorsal vagal of heaviness, exhaustion, just no
Okay.
energy.
So that is
Oh,
checking in. Am I feeling calm? Am I feeling anxious? Catching it, noticing where they are.
yeah, do I not have any energy and feel stuck and have
Mhm.
this inner anxiety, but from the outside they appear calm?
Oh, yeah.
So that is more in the dorsal vagal. And then again, also it could shift in and out into sympathetic. And now I'm anxious again. I got energy and get this done, but I feel really anxious or can't sleep again. Or so that's the first thing, just to understand, okay, these are the three states. This is where you could be. These are the variations where we could find ourselves.
Mhm.
And then the language of the nervous system. The language of the nervous system are our senses, what we hear, what we see, what we touch and feel, taste and smell.
Mhm.
So that is how our nervous system responds. What we see,
Okay.
right? What we hear. Um, the good thing about that is also we can work with our nervous system through the same way through that language, through senses. So
Okay.
this is where I teach, for example, orienting. We can do that for a moment for yourself right now, just to see. Put your awareness, shift your awareness in your body and just feel yourself
Okay.
where you're at and observe without changing your breath
Mhm.
and feeling your feet on the ground
Mm.
and maybe your shoulders, your neck, just awareness. Just be aware of it, observe and notice.
Okay.
And then look around your space and just see if there's anything that you can find that attracts your attention, your eyes, that's nourishing, nurturing, beautiful,
Mm.
calming, just something that speaks to you. And just stay at that with your eyes at that object or picture or whatever it is.
Mm.
And just take a moment and stay right there.
That's interesting.
There we go. And you had your shoulders dropped already a little bit.
Yeah,
Sometimes,
and I was sitting here up on my tiptoes because I'm sitting in a funny desk, and all of a sudden
uh-huh.
everything just went,
Yeah. So
"Whoa."
your nervous system just received through its language, through the eyes, the
Mm.
sense of, huh, this is calm. This is, oh, I like this. This is beautiful.
Mm.
That was already the first response and of the nervous system. So that's how we utilize the language of the nervous system.
Mm.
And different tools that I'm learning for that I'm teaching, for example, this first one of all that we call orienting
My
to
goodness. I can't say
awesome.
how that's so important because I have so many people that come through my office these days who are really overwhelmed. And
Mhm.
they can't put their finger on exactly they have a busy life, but they're like, "I've always had a busy life." But to have a tool to hone in and then have a way to reset, I think it would be a really empowering thing.
Yes,
I mean, stating
absolutely.
the obvious there, but that's cool.
And there are just really simple tools, and they sound so simple for our brain.
Mm,
Doing them is then often not so simple. So it really takes the practice of doing them daily. So our nervous system gets used to it. And it's an integration into our daily life of, oh, I'm just going to pause for a moment and I'm
Mm.
just going to look and watch these birds out there. Or
Mhm.
just to, this was really busy. This really just really stressed me out. See if I can just take a moment for just 1 minute and
Mhm.
pause, orient to something nurturing, feeling into my body, how my body responds. Oh, there was a spontaneous deep breath. Oh,
Mm.
okay. My shoulders dropped a little bit.
Love
Oh,
that.
and I can feel my feet more on the ground. Oh, okay. Oh, and my
That.
belly. Okay. Observing the breath. Hmm. I notice it expanded naturally a little bit without me doing anything, right?
Oh. Mhm.
So really allowing the body to respond and really tuning in to the response of
So
the
awesome.
body and the nervous system that way.
So
And
if
then
I'm in a combination, like if I get a treatment from you and you do some craniosacral and remove any of the blocks that you talked about, and I have these tools to take out into my life,
mm,
I'm liking the sound of that.
yeah, and that's what I find now really as has been diving deeper into the trauma informed work,
Mm.
which what
What
is
does that
trauma
mean?
informed formed? What does it really mean exactly? It's such a good question. I think through my experience and through my training over the last few years, especially, but also the last 10 years of really uh, being able to attune to each individual and meet them where they are, and then integrate the somatic work, the Cranio Sacral Therapy work, integrating principles from the polyvagal theory, integrating what be known sometimes as parts work, which is the therapeutic as different parts of our being are coming up, being emotions. It could be even a pain because that's how our body can talk to us.
Mm-hmm.
Otherwise, we don't pay attention, right? If
Okay.
that shoulder is not painful, we're not going to pay attention to the shoulder and just take it for granted and use it however. As
Mm-hmm.
soon as a part of us is speaking up with pain, we're like, oh, what's going on? And then
Mm-hmm.
we pay attention. But also emotions that might come and being aware of it and really being with them and giving them the space and the welcoming to come up in a safe place that's resourced, that we have tools with, that we have resources for, and somebody who can stay present with us.
Mm-hmm.
Um, that is part of what I see really looking at this complexity of being and integrating different trainings that I've been going through in that moment that I know if something comes up, I can hold the space and I can be there and
Mm-hmm.
hold the space, the safety, the support
Mm-hmm.
to just sit with that and be with that. Often we don't even have to do anything with it.
So this is the trauma informed work, if I heard what you said, when someone is there experiencing the body work from you, the different layers of body work that you're offering, the craniosacral, the organ manipulation, the somatic work. I guess somatic just means body.
Yeah, and somatic experiencing is a specific technique developed by Dr. Peter Levine.
Okay, I'm going
So,
to ask you about that in a second, but I wanted to see
yeah,
the trauma informed where maybe someone's on the table and during the session, an emotion might be surfacing. Is that what we're talking about?
it might, yeah, emotion might come up, right?
Or a pain?
Yeah, and that's exactly what we work with them. Yeah.
Okay. And so you're providing space for them to allow that emotion to be felt and just don't try to stop it. Just let yourself have it. Or would that include also if I have pain in my shoulder, just be with the pain in my shoulder while you're working?
Yeah, and that's a very different concept for a lot of us because usually when pain comes up, oh, man, this shoulder or it hurts again, and now it's in the way, and I wanted to do this and that. So I try, but integrating it as almost like this little child of yourself
Mm,
who is coming and complaining. And then when we just push it away and say, don't want to ignore it or don't have time to deal with you right now, that's not going to help this little kid, right?
Mhm.
All it wants to be seen, to be hugged, to be acknowledged, to be supported.
Mhm.
And that's the parts of us that come up. That is usually what they want. And when we can just sit with them in a
Mhm.
love supporting way, it's a very different experience.
Mhm. And you might
And,
get some release of whatever's holding that there.
and then very often they're quiet down.
Mm.
And very often there can be a beautiful being with each other. It doesn't even have to happen anything yet. And those parts can go as slow as they need
Mhm.
in their own pace. And same with us and the patient or the client, wherever they are, we go as slow
Mhm.
as meeting them as slow as where they are.
Well,
And sometimes it's just sitting. Sometimes we maybe have a little dialogue with what this is about. Or, yeah, but I'm not a counselor. I'm not guiding or leading anything. I'm just witnessing and being supportive, present, and
mhm.
trained to be that witness and support person
Mhm.
so the client can be with whatever is coming in
Mhm.
a safe and supported way.
Got it.
Yeah.
That's amazing. I think it's people would probably have to come have a session to really bring this in because it's hard for most people to imagine that my shoulder pain is coming from something that I'm not allowing to flow. I'm sure there are other concepts like you fell off a ladder. And yeah, you fell off a ladder and you might still have the fear and what you what story went through your brain when you landed and how did you get to the ER and all that stuff holding in a way that's like, how are you going to get this shoulder to physically heal with those other things stacked in there? And if I'm hearing the different things you do within your work can really let somebody unravel all that, just let it unwind.
And that is a very good example because this is exactly, it could be very physical. So we definitely work with a physical part too. But that's exactly the key. So we can follow the ladder. We can have a wonderful day. Everything is good in life. We're very balanced, regulated, follow the ladder, hurt the shoulder. A couple of days later, it's gone and it's good.
Yeah.
However, the
Mm.
body graded, or everything is pretty balanced and regulated. And
Hmm.
it's that. However, if we have not such a great day, or if we are in a stressful part of our life, if there are a lot of things going on, if we're more in a state of anxiety when things are tense already,
Mm.
if all these things can influence this injury, the same injury in a different way. So two people can have the same injury and have
Hmm.
a totally different result of
Understood.
coming out of that injury being, oh, 3 days later, everything is good,
Hmm.
or having chronic pain developing and it just got stuck in a pattern that
Hmm.
that's stacked with other issues around this shoulder injury
Good.
and
Makes
has
sense.
a deeper, so there are deeper layers and other things around it that contributed to make it linger in a
Got it.
way.
Now, how did you get interested in this? I'm thinking here's you're working as a physical therapist, probably getting great results with physical therapy because there's such great tools in that practice. What had you lean off into this direction? What happened?
Yeah, so back then, it was about 30 years ago when I took my first class of Cranio Sacral Therapy. I worked in a physical therapy practice. We had a lot of workers' comp injury patients. And I remember I was working with this shoulder injury with this patient with a shoulder injury for weeks already. And we made our gains slowly but surely. But then I came back from this cranial psychotherapy class, the first class, and I said, you know what? I learned this thing I'm going to try to do today. I have no idea. I didn't even know yet what I was doing anyway. So I just worked with him And after the session, he got up and then stood up and swung his arm and looked at me like, "What did you do?"
Oh,
And I said, "I don't know. Why? What did I do?"
I hope
And
it was
he's like,
good.
"I don't have any pain. I can swing my arm without pain for the first time in months." So I was like, wow,
Wow.
something happened. I was not even understanding yet what happened, but
Mhm.
I knew something shifted in a big way for him.
That's amazing.
And I'm like, I need to learn more about this. And that's where it took off. And I just got dived deeper and realized muscle injuries is just the end of
Mm,
something that needs to be treated from the core, from the nervous system, because
interesting.
the nervous system sends the signals to the muscle to relax or to tighten up, right?
Mhm.
Our
That's
brain
the
is,
root.
and our nervous system reacts to our emotion.
Makes
It's such a huge cycle of wow.
mm,
It's our nervous system that does it all. And our nervous system's language are our senses, how we receive things.
mm.
And that, and in the polyvagal theory, the vagus nerve, 80% of the information goes up from afferent to the brain and only 20 from the brain down. So
Huh.
it's senses and how
Can
we
you
respond.
say that again to me? For people who don't know about afferent and like that sort of thing, can you describe what you just said again about the vagus nerve?
So what we taking in senses, what we feel, what we see, and how we respond,
Mhm.
80% of that goes up towards the brain to tell it
Mm.
how to respond, and
Okay.
only 20% come down to our viscera, to our um, vagus nerve saying what we just realize this is what we should do.
Okay.
So there's
So,
a lot through this, our sensory world is really the leader here.
okay. So yeah, all that what
It's
you're
very
taking in,
interesting
80% of that is informing the body.
how safe we feel,
Oh, wow.
how supported we feel. We
Mm,
can tell ourselves, we can
mm,
tell our nervous system, why are you still panicking? The tiger's
mhm.
gone, right? System says, I don't feel it yet.
Still hanging on.
I
You
don't
know,
feel it yet. I need to feel it. The felt sense of safety. That's where the touch comes in.
ah,
That's where we give ourselves that containment touch, which is
mhm,
another somatic work, where we're holding ourselves. So
mhm,
our nervous system responds to the touch and can feel the felt sense of safety
mhm,
and says, oh, okay, now I can feel that I'm supported and I'm
mm.
okay.
Boy, when I hear you describe this, I think about so much of this is under the radar for us. We're not aware of thoughts and emotions and sensing things we're sensing. We're usually doing so many things at once, and some things are subconscious. Like you might not remember something that happened
Absolutely.
that put you in a state of fight or flight, and it's still hanging out in your system like that, affecting your health.
Oh,
So,
yeah, we can remember a lot of things. That's the beauty about this work because you don't have to remember. We're not going in our head. We're
mhm,
not going into the story
mhm,
because it's not about the story.
mhm.
Just like we talked about the person who fell off the ladder, right? It's the same
Yeah,
story, but the
same
outcome is
here.
different
Uh-huh.
because it's not about the story helps us to understand what shaped us and how
Mm,
we get there.
mhm,
But the deeper healing is in the nervous system.
mhm,
Um, and the body is holding. So it's about the emotions that we were left with
mhm,
in the event, whatever we felt. That is what we need to address and heal then and work with and release because
understood.
this is what our nervous system holds.
Mm.
And this is what our nervous system might get stuck in wherever it is.
So we can't regulate hormones, sleep cycles, digestion, inflammation, tissue healing, all that stuff.
Yeah, because if you're still stuck in fight and flight, in the sympathetic, our nervous system um, is designed to have the blood flow go in our big muscles to run
Mhm,
a tiger. And
mhm,
it's not about digestion. It's not about thinking.
mhm.
So we don't digest, we don't absorb in that state properly.
Right, and I may not even know I'm in fight or flight. I might think I'm doing really well. I'm
Exactly.
walking around
E-
feeling all good. What I
Exactly.
don't realize is inner regulation might be off because of things that are under the radar, and I don't understand why I can't get pregnant or I can't, get my blood pressure down or all these things.
And all that is still nervous system regulations that we're not aware of.
Mhm,
There's so many tools now to regulate that. I think it's becoming more mainstream, really.
mhm,
Um, a lot more people are aware of vagal nerve regulation, nervous system regulation. All the experts in the trauma world are becoming coming out more and really. I actually like Dr. Peter Levine, who is the founder of Somatic Experience. Bessel van der Kolk. They are just really who wrote the amazing book, The Body Keeps Score. Just all about that, what we just talked about. So I think somatic work is really getting now the attention, how important it is to integrate for our
mhm,
healing, for our journey of feeling our best self and getting back to our aliveness,
mhm.
our inner aliveness.
I have to say what I one of the things I really love about your work and what you're explaining today is you really empower the person
Mm.
through the books you recommend so they can learn and understand how this works and also the tools that they can bring into their lifestyle. Like you're really empowering people to be self-sufficient.
And that's what I think is so important because the empowerment of really realizing, wow, I have
That
tools
alone gives me relief.
inside of me that I can work with and help regulating. I understand these things now. I have tools. And again, it's we need the somatic work, Cranio Sacral Therapy, somatic work, those self-help tools. We need the parts work, learning how to work with the emotions when they come up and
Mhm.
wherever that goes,
Yep.
and the biology. That is
Mhm.
your part, right? To find the deficiency, because if you're totally deficient, sometimes we don't have the energy to do the emotional work or to do all the other work because we're so drained that we can barely do anything. So
Mhm.
sometimes it's maybe we need to address the biology first and get them a little bit more the energy for the mitochondria, for the cells and everything, and see where the deficiencies are to give them to help them to get out of that vagal dorsal vagal or the freeze
Makes
and
sense.
and then integrate whatever else. Yeah, wherever anybody is, all these parts are playing a role and it's we are not aware of it.
Yeah.
And there are simple tools that are helpful that everybody can learn.
And
There's support and resources out there like you and me and many other wonderful
Mhm.
guests.
So I noticed out on your website, I don't know if this is still current. So are you still doing monthly classes?
Yes, I actually started that a few months ago last year as I got more and more into somatic work. I
Mhm.
felt like I want to give my clients another tool where we can get together and practice somatic work together.
Okay.
So I have once a month a Zoom class. That's typically 45, 50 minutes. Last time I went over, it was 60 minutes, but I had so
Oh
much
boy.
prepared. I
That
try to
happens.
always integrate a topic. Last month was anxiety. So that was a
Yeah.
very important topic right now that's going around. And I just wanted to give some tools for that to deal
Love it.
with. And so we did. And then it's a somatic experiencing. It's an experimental class.
Mhm.
Um, you just have to show up, not even being on video. If you don't want to, you don't have to interact. And I just do a little introduction, what we did today to understand the nervous system and the language of the nervous system. And then we're going into some guided somatic work slash meditation.
I love it.
Yeah.
Wow. I'm so grateful that you took some time to come talk with me today so people could hear about this. I would say in my own practice, there's maybe 20% or so of people, like I say, they're doing all the right things, but they've hit a wall. And it's your work. There are others, but your work as well that I send to for touching in on these subtle underlying issues that can be, unbeknownst to the person, part of what's got them stuck. And I love it that you're giving them tools, a class to come experience and try to practice what they've learned, and also books you recommend, and then the treatments themselves. It's just really happy that you're out there doing this work.
Wow, thank you so much. Thank you so much for having me. And I think I want to just emphasize one more thing. There's a lot that we talked about today,
Mm,
and we don't need to do any of that and understand any of it because our beautiful body does exactly what it's ready for.
mm,
It does exactly what it feels safe enough to do and with who.
mm.
And we don't have to figure it out.
Less
Uh,
brain.
we can just drop down and be, and there's nothing expected. We don't have to, we start judging ourselves. We try to analyze ourselves. We try to have these expectations. If we just really allow the body to show us what it needs
Mhm, mm,
and to do, and as our body does the self healing when it feels that supported way of being. And that is also part of what I try to help people to be with,
mm,
because we get so much in our society, in our mind. Maybe I should try that, or maybe this. And media is full of all kind of help stuff that,
mhm. It's all
right?
like heads, you
And it
think
can
figure it out.
healing can be stressful. That can be overwhelming in itself. Just
Mm,
trying to do all these modalities. Oh my gosh, did I do this? Did I do that? So it's sometimes it's nothing you need to do.
mm.
Just be.
Oh,
And
I
let's
love
just see what your body needs
that.
for
Mhm,
today.
mm,
And that
mhm.
kind of, I want to really come in and support and see.
Provide that space.
Yes, providing that space. Exactly.
I love it. Thank you so very much for spending time with me. And I'll just mention that it's called Body Connection is your business. Is it connections?
Body connections. Yes.
Okay.
Many connections in our body.
Okay. Yes, not just one. But we'll have links with your email and phone and also your website so people can find you.
Wonderful. Thank you.
Is there anything else you want to share?
Maybe actually, yes. I'd like to share one quote
Let's do it.
from Dr. Peter Levine that I really like. He is the founder of somatic experiencing.
Mhm,
And I really liked the way he said, as we talked about trauma and any event that our nervous system felt overwhelmed,
mhm,
not necessarily in our society definition what we think is a trauma, any event that our nervous system felt overwhelmed at some point. So what
mhm.
he says is trauma is not only what happened, but what didn't happen.
Mm,
Often not the memory or the event, but the trauma that nobody was there to hold you and hold space for you.
I love that.
Yeah.
So that in itself can be a trauma, just not feeling like anybody's gotcha.
Or too little, too long.
Mm, mm. Wow.
Yeah.
God, I want to come get on your table. It sounds so safe over there.
It's not only too much, too fast, but also too little, too long.
Understood.
Yeah.
Wow. Thank you so much, Christiana,
Thank you,
for,
Susie.
for
And
being here with us today. And thank you, listeners, for taking the time to check out another practitioner in our area here in Vermont who's providing some root cause based medicine, allowing folks to get underneath the story and maybe uncover some things that might be keeping you stuck in your health. So I encourage you to look for Christiana and see if she can maybe provide you some support in your health and vitality. Thank you so much.
Thank you so much for having me, Susie.
Mhm. Thank you so much for tuning in to today's episode of Next7. We hope you enjoyed the conversation. Don't forget to like, share, and subscribe so you never miss an episode. Stay connected with us on social media for updates, behind-the-scenes content, and more. Until next time, stay well and informed so you can be a part of creating a thriving world for today's elders and the next 7 generations to come.